I'll just tell you.
Okay.
Yes, hello, Jambu and Salam. I'm Himanshu Sharma, welcoming all the viewers on our virtual platform. Another very special live moment for us. It's time that another set of people who visited us as patients and returned home as friends, we are joining all of them online. So all the friends of ours that you see around here today are very special to us in one way or the other that we will be discussing. There is a popular saying, when life knocks you down on your knees, you are in the perfect position to pray. Knee pain knocked many of us down, but our friends you see in this session stood up and conquered it to back on their knees. So many of the people who are present here have undergone knee surgeries at Zydus Hospitals under the care of Dr. Daria Singh, and they are going to share their special moments with us. So today we'll hear some of the most extraordinary stories of people who not only just conquered pain, but also their fears. Fears of undergoing a surgery, fears of undergoing a knee replacement surgery. So without wasting any more time, I would love to introduce you to our special guests online today in this session. Honorable Kintu Florence Tumwin from Uganda. Madam is a very busy grandmother, a busy politician, and a women and peacekeeping activist. We welcome you to this session, Madam Florence. It's an absolute pleasure to have you here.
Thank you very much.
I have my personal friend and our massive, massive support in Tanzania, Mr. Ayub Isaac, who is currently in Zanzibar, who is joining us from there. He is a business person and a prominent social worker. And beyond everything else, a man who's close to our heart. Whenever we are in trouble, we are in Tanzania, the only person we think of is him. Ayub bhai, thank you very much for joining us. It's an absolute pleasure. So, I welcome you to this session. Then we have Aftab bhai, Mr. Aftab Hussain from Mombasa. As you see, his fitness is amazing. And he's one person who has been like many roles in one guy. I keep on hearing stories about him from our friends in Mombasa, and everything is very encouraging. So he is not just a social worker, he is also a person who is ever ready to help anyone who comes his way. He has many achievements, many feats under his name when it comes to community work. Plus, as you see him, perpetually smiling, always jovial, never worried. So one of the very few people we have come across like him who started working the very same day of surgery saying that, oh, I want to take a discharge, I want to go home, I feel perfectly well. So Aftab bhai, welcome you to this session. And finally, we have Leela Auntie, Leela Benmore, wishing you a very happy birthday, Leela Auntie, first of all. And it's a pleasure that we have you on this day with us. So she's again, basically she's an Indian and Kenyan together. And right now she's in India, but currently settled in Nairobi. So she's a grandmother, a very active and a jovial person. And we keep on home Nairobi. What we do with Ayub bhai when we are in Dar es Salaam. So thank you very much. It's an absolute pleasure. Obviously, I have to also introduce the man of the moment. That is Dr. Daria Singh. He has been more than a doctor to all of them. All of these people who are present here, he has not just been a surgeon, but also a part of their families, their lives. And one more thing I would like to add here, Mr. Ayub has not undergone any knee surgery, but he has been a guide to many who had doubts. So he is going to share his stories of people with the kind of doubts that they came with and how they went back with. So I would now invite Dr. Daria Singh to share some of his thoughts before we go live with Honorable Florence Kintu. Dr. Daria.
Dear friends, a very good evening. At the beginning, I welcome you all in this Facebook live session to share your stories. This human gestures of yours will be of great help to many in reducing their anxieties and sufferings. Your narration will help many people who are seeking their solution for their knee pain. It will help them to guide to choose right treatment at appropriate time and place. It will also help us. Your feedback will help us in improvising and strengthening our care plan further that belong to. For the information of our viewers, medical comorbidities is a big challenge for successful outcome of total knee replacement surgery. And these triumphant warriors who present here had multiple comorbidities when they presented for their total knee replacement surgery. And all of them had a very successful knee replacement surgery. Now I invite Honorable Mrs. Pinto Florence for sharing her views and her story.
Madam Florence,
Thank you
please.
very much. Thank you very much, Dr. Daria Singh. I am one of the beneficiaries of this wonderful surgery on total knee replacement. I wish to share my experience with the rest of the colleagues that I had knee pain for quite some number of years, and it kept on increasing all the time. At one time, the only solution that I had was to keep on taking painkillers. Eventually, they stopped working, so I would be administered on an injection on a quarterly basis, sometimes 6 months, which eventually didn't help me. I think my body just got used to it, and it felt it had to get something better. So I was advised to do a knee replacement. That's when my medical insurance contacted Dr. Himanshu, and we got in touch with him. I want to thank Mr. Himanshu so much that the work you have done for a number of our countries is helping so many people, and I'm confident that it will bring on board very many people who were suffering like many of us were. So the question was, do I do one knee or two knees? Definitely, I was advised to do one knee. But the politician in me was telling me doing one knee and then taking 6 or so months to get better, and I go back for another knee. I took the risk of doing both knees. And everybody was saying, Florence, you are not serious. You will not survive doing 2 knees. So Mr. Himanshu organized for me, and I went to meet Dr. Daria. An arrangement was made for me. I want to thank them. The hospitality that I was given, the reception, made me get a hold of the fears that had come from Uganda. With me, I went with my daughter. She sends greetings. And both knees were actually operated upon. When I look at the CD following the operation, I just say, I think Dr. Daria is a God-sent doctor. To me, he gave me back my knees. Each time I communicate to him, I tell him, your knees are doing well, because I don't have any problem with the knees. I do my work very well. Definitely, the arthritis issue keeps on, but as long as you have replaced the curve and they fixed, because I've seen some people, especially in my country, who have done knee replacements and are not working well. They have issues. But I look at myself, having done 2 knees at a go, and I remember to have started walking using a walker in just a few days after the surgery. Even the doctors there were saying, wow, it is amazing. But it is that confidence that the team gave me, the confidence that Dr. Daria gives a patient, makes you not feel the pain, yet you have the pain. It gives you the hope to say, I must walk again. And I walked again. I feel well. As you can see, if you look at the pictures, when I went to India for the surgery, if you look at the picture at me right now, you realize that I'm far, far great. I'm okay. In fact, if it wasn't a Zoom meeting, you would see me running. I move faster than people who have normal knees. So I want to thank the Zydus Hospitals. I want to thank Dr. Darian team. I want to thank Mr. Imanshu, who has been a coordinator to all of us. And I want to say, we are here as disciples. We are going to spread the gospel the more, so that people do not keep in houses because they have knee problems. You can always get a replacement and walk again. And many people are ready to have the operation. Some are limited by resources, but I'm praying for very many people to have solutions. And I know that with time, people will get the knee replacement and walk like me and many of you are walking. I want to thank you so much for listening to me, for sharing my experience, and to say, please inform as many people as possible who have knee issues, who have arthritis, that there is a solution. New knee, new life is the solution. I thank you so much.
Thank you, ma'am. Thank you, Ms. Florence. It was indeed, I remember very clearly when I first time met you in Kampala, you had so many questions and you had to climb first floor, and I remember how difficult it was for you with 2 crutches, and now it's an absolute, short of words to say that how happy one feels when we see you back on your knees, back in your life and active politics. So that is something which is a very promising thing for us. Thank you, thank you. Aftab bhai, I would like to invite you now to share your views, because you have been here multiple times for multiple reasons.
Yes, thank you.
Quickly, if you would like to brief us all. Thank you, Aftab bhai.
Thank you, Himanshu, Dr. Daria. Thank you very much. Thank you to the whole team and the whole team of Zydus Hospital. I actually had come to India about 2 years back. I had severe pains on my left knee due to sports injury and due to arthritis also. So I had come with my wife. My wife, she had some medical issues. After her operation was done, I came to Himanshu and explained him about my knee injuries and the pain. I used to take a lot of painkillers, but it was going on worsening day by day. Then Himanshu took me to Dr. Daria. Dr. Daria was like an angel to me. When he saw me, he took me for X-rays and everything, and he told me you are going to be back fit on your legs and you'll start walking. And eventually, after my wife got better, I was taken into the theater, and my knee was replaced. It took me about a day. I started walking. Within 24 hours, I left the crutches, and I started walking on my own with the help of Dr. Daria. He gave me a lot of encouragement to walk without the crutches. And Alhamdulillah, past 2 years, I have not even taken a single painkiller, and I've been walking. I've been walking my regular work. I've been going back to gym now. And Thanks to everyone. Thanks to the team of Zydus, mostly Dr. Daria and Himanshu. They did a great job. And today I'm back to normal. I'm working. I'm going to work, back to gym. So thank you very much, Zydus Hospital and Dr. Daria, Dr. Himanshu. Thank you very much.
After Bhai, thank you very much for sharing. I remember each moment of while you were around, you had so many things to, juggle between. Once your wife is undergoing surgery, recovery issues, and then you were worried that and obviously you could not come back again for next 6 months. That was another issue. So everything, all in all, went well, and I'm sure you are happy that you took that decision of going ahead with the surgery in spite of very short time. Ayub bhai, I mean, it's your turn now to share with us. I just want to say one thing to all of you. If there is anyone responsible for us being in Africa, it is this man in the cap whom you see here. So whatever we are known in Africa, whatever love, affection, care we have received from the people there, it is thanks to Mr. Ayub, who has been instrumental, who has been cooperative, supportive at any point in time for anything that we require. So Ayub bhai, you will have to share. I'm sure you will have so much to share, but I don't know how you're going to sum it up. So please, next turn is yours. Please go ahead, Ayub bhai. Thank you.
Good evening, colleagues, friends from East Africa, Himanshu and Dr. Daria Singh. I am not a patient of knee surgery, or I have never done a knee surgery. But my experience is more than the people who have done knee surgery. Because so many people I have sent myself to India. Because earlier, I've known Himanshu for the past 20 years now, and Dr. Daria Singh as well. So our friendship goes a long way out. 20 years back, my mother had gone bilateral knee surgery. And back then, you see, we didn't have even hospitals in Tanzania where people could do knee surgeries. Now we have some hospitals here that they do knee surgeries, but back then we didn't have any doctors actually who were trained to do knee surgeries. So we had to fly back to India and do the knee surgeries. People were actually ready to have a steroid injection in their knee than doing knee surgery, because they were so much afraid that they were thinking that knee surgery is a life-threatening surgery. They were not confident enough that they would survive after the knee surgery. So slowly, when Dr. Daria Singh came to Tanzania, he assured them that this is not a life-threatening surgery, that your pain eventually goes out. So Dr. Daria's assurance and his success in surgeries is the main concern here. Our community, especially the Maiman community in Dar es Salaam, so many people, like more than 20 people have gone through knee surgeries, and that is all, the thanks goes to Dr. Daria Singh and Himanshu and his team. People, the main thing about knee surgery is the chances of getting infection after the post-operative care actually. But I can assure you, and I can assure all the people who are watching today, that Dr. Daria Singh is a personal caretaker after the knee surgery. Normally, the doctor doesn't come after the knee surgery, but he takes care of the patient himself, even after the knee surgery. He comes himself, he does the dressing himself. He could have done, the nurses do normally the what you call this, after, what do you call, Himanshu, after doing the surgery?
You mean the dressing part or the physio?
Yes. The dressing, yes. The nurses normally do the dressing, but he himself comes and he does the dressing himself. That is the main good thing about Dr. Daria Singh. He takes every patient as his own personal patient. That is a good thing about Dr. Daria Singh. So back in Tanzania now, people are so much assured that knee surgery is one of the easiest surgery and are willing to go to India for surgery. And once again, Leela Ben Modi, happy birthday. And one thing I forgot to say, Madam Honorable Florence Kinto said, that people think he is a God sent. I would say people think in Tanzania he's a second God to lead. Thank you so much.
Thank you, Ayub. That was little way off board for us, but yeah, I mean, I can understand the kind of connections we share and the way things have been. We have both seen enough of goods and bads happening, and we have lived through. Thank you, Ayub. It's an absolute pleasure to have you join us today. Thank you. Leela, whatever you want to share with us, you can talk in Gujarati, Hindi, English, whatever you feel is fine, perfectly okay. Leela, I cannot hear your voice. Yeah, just unmute yourself, Leela.
Yeah, now it's fine.
I don't know, we are still facing. Auntie, just disconnect and reconnect once. Just disconnect and rejoin. I think there is some audio problem that will be sorted. Just click again on that link. You can exit the meeting and you can just click again. So we are just waiting for Mrs. Leela to come back. So Ayubi, it seems to be Zanzibar is good.
Oh yes, Zanzibar is very good.
I'm happy that you, at least in Dar es Salaam, you're not wearing any mask, but in Mombasa, I think after by you still have to wear masks, right?
Yes, true. Here in Mombasa, we still have to wear masks. We have the social distance. We have the curfew still on here.
Oh, okay, okay. So Tanzania is a little lucky on that front. Yeah, Mrs. Skinto is back with us. We lost her for a short while. The connection. Now Mrs. Leela is also joining us back. She would be online in a moment. I think it will take 2 minutes for us to be back online with you. Yeah, I think you can speak now, Leela.
Jai Shri Krishna. Good evening.
Jai Shri Krishna.
મને પણ સખત જ દુખાવો થતો પગમાં પહેલા બહુ એટલે આમ હું ચાલી બી ના શકું કેટલી બધી દવાઓ લઈ લીધી મેં એલોપેથી હોમિયોપેથી ફિઝિયોથેરાપી બધું જ કરી રહી હતી 5-6 વર્ષ સુધી એમાં છેલ્લા 1.5 વર્ષ 2 વર્ષ તો મને એટલો સખત દુખાવો થાય ને કે હું ક્યાંય સીડી બી ના ચડી શકું ક્યાંય જઈ બી ના શકું એવો મને પ્રોબ્લેમ થઈ ગયેલો પછી હું છે ને અમે અમદાવાદ આવ્યા તો અમે અમારે એક સંબંધીને ત્યાં છાપાનું ઓપરેશન કરાવેલું હિપનું તો પછી સ્પેશિયલ રૂમમાં અમે ઊભા હતા દરિયાસિંહ સાહેબ મળ્યા અમને પછી મેં વાત કરી તો પછી મને એમને કીધું કે આંટી હું જ કરું છું ની રિપ્લેસમેન્ટ તો મને એટલું બધું આમ સારું લાગ્યું કે પછી આમ થયું કે હું એમના જોડે જ ઓપરેશન કરાવી દઉં બીજું કંઈ દુઃખ સહન કરવું જ નથી હવે પછી અમે અમદાવાદથી પાછા નેરોબી ગયા પછી બધું નક્કી કરીને અમે 2018માં જુલાઈ મહિનામાં અહીંયા આવ્યા ઝાયડસમાં 2 પગનું સાથે ઓપરેશન કરાવી દીધું એમાં તમે બહુ સરસ માર્ગદર્શન આપેલું અમને બહુ હેલ્પ કરેલી દરિયાસિંહ સાહેબ તો પછી કઈ કહેવાનું જ નથી મારે. એ તો બહુ જ આમ હસમુખા, પછી આમ લાગે ને કે આમ આપણને એમને જોતા જ આપણું અડધું દુઃખ તો દૂર થઈ જાય. અને ઓપરેશન પહેલા તો એટલી સખત ડર લાગતો હતો કે એમ કે શું થશે, કેવી રીતે ઓપરેશન થશે. પછી અંદર થિયેટરમાં ગયા પછી મને કે આંટી કેમ છે, એટલું બધું ધ્યાન રાખે આમ કે પૂછો નહીં. બહુ જ આમ આપણને એમ સંતોષ થાય કે ના, ડોક્ટર જોડે જ ઓપરેશન કરાવે, બીજે ક્યાંય જવાય નહીં. ઓપરેશન પછી થોડુંક ધ્યાન રાખવું પડે, ઘણું બધું ધ્યાન રાખવું પડે. એક્સરસાઇઝ કરવી પડે, પછી યોગા, બધું ખાવાનું બી ધ્યાન રાખવું પડે, વોક બી ચાલુ રાખવું પડે. એવું બધું ઘણું બધું ધ્યાન રાખવું પડે. લગભગ 2-3 મહિના સુધી તો બહુ સારી એવી એક્સરસાઇઝ કરવી પડે છે. પણ પછી તો એટલી આમ ખબર બી નથી. અત્યારે હું 6 મહિનાથી હું ઘરનું કામ જાતે કરું છું, બધું જ. પણ મને એવું કોઈ લાગતું નથી કે મેં ની રિપ્લેસમેન્ટ કરાવ્યા છે.
આંટી, તમે સજેસ્ટ કરશો લોકોને કરાવવાનું હોય તો કરાવવું જોઈએ આ ઓપરેશન કે ના કરાવવું જોઈએ?
હું તો એટલું સજેસ્ટ કરું કે કોઈ પણ દુખાવો થતો હોય ને તો સીધા જ દરિયાસિંહ સાહેબ જોડે જતા રહેવાનું.
Thank you, Leela aunty. Again, wish you a very happy birthday.
હું તો નેરોબીમાં બી બધાને કહું છું કે જવું હોય તો ઝાયડસ હોસ્પિટલમાં દરિયાસિંહ સાહેબ ડોક્ટર છે, હિમાંશુ બી તમને ગાઈડન્સ કરશે. હું બધાને જ કહું છું. અને એમાં 1-2 જણ તો કદાચ આવ્યા પણ હશે. એક જણે તો ત્યાં ઓપરેશન બી કરાવ્યું છે.
Right. Okay. Thank you, aunty. Thank you very much. Now, as we draw to the close,
દરિયાસિંહ સાહેબ નો ખૂબ ખૂબ આભાર. ઓલ ધ બેસ્ટ.
Thank you, aunty. Thank you.
બધા પાર્ટિસિપન્ટને વેલકમ.
Yeah. Dr. Daria, would you like to say something to our friends before we draw curtains to this session? Sir, you will need to unmute yourself. You are muted.
Thanks, friends. Thank you very much for sharing your stories, for sparing extremely valuable time for us and for our viewers. My special thanks to Ayub Bhai, who is like our extended family member, who is extremely helpful for us as well as for our patients. Ayub Bhai, thank you very much. Here I want to share one more thing. With the precision of surgery, with the consistent precision of surgery, with our true aligned technique, with minimal blood loss, with the minimal soft tissue trauma, and with a very effective pain management protocol and a faster rehabilitation, we are able to discharge our patient within 24 hours of surgery. And this practice we have started from this March. So once again, thanks a lot for kind words of appreciation, and thanks a lot for giving me opportunities to serve you, to be a part of treatment of your pain. Thank you for everything. Thank you.
Thank you, Dr. Daria, for sharing your views on it. So before I draw curtains on today's fantastic session, where I feel like I'm with my African counterpart family, I would like to reiterate what Dr. Daria to the pandemic, the surgeries have to go on, and in order to reduce the stay of patients in the hospital, now Dr. Daria is able to discharge his patients in 1 day after the surgery. So that is an achievement that has been possible thanks to all your support, your motivation, and your consistent love and affection that you've all been giving to us. So my eternal thanks to the people of East Africa who have trusted us, loved us, embraced us. And we have never felt that we are out of India, when in fact I feel more of a family when I'm in Tanzania, because when I talk to people, I tell them, if you look at my phone, there are hardly any numbers which are Indian. Everything starts from TZ. So people wonder where you stay here or you stay in Tanzania? So I'm thankful to all of you who were able to spare time for us today from your busy schedules. Leela aunty, a happy birthday again to you. Stay safe, stay well, and we
All
wish
the best.
everybody a very good health. Thank you. Thank you.
Yasin
Thank you.
Saib ne all the best.
Thank you.
Mansoor bhai ne all the best.